Hi, I'm Jason DeVries. I think one thing that's very important about my practice is that I try to combine the podiatric side. I did do 3 years of residency studying podiatric medicine and surgery. But then I also did the fellowship at Orthopedic Foot and Ankle Center. So I think that really gives me a unique perspective to combine both an orthopedic perspective as well as a podiatric perspective. My father was a podiatrist, so I saw him when I was growing up taking care of people, and that was really interesting to see. After I got into school a little bit more, I kind of saw all the things that could be done. That's why I chose to do the fellowship training afterward, to really kind of expand into more of the surgical aspect of it. The thing I think is most important when talking to patients is that they get educated so they understand what we're talking about here. That way I figure I can work with the patient to make the best decision for them. If they kind of understand the problem, they understand the pathology and what we're trying to accomplish, then I think they can really be advocates and really be able to choose the best decision for them. When patients come in to see me for the first time, typically we'll get x-rays if they have any type of musculoskeletal complaint. That way we can see what's going on inside the foot as well as what we see on the outside. After they get checked in, have the x-rays, I'll come in and we'll discuss. First thing I do really is not even look at the foot at all, but we really just talk to the patient, find out what's bothering them, find out how long it's been going on, what they've done, try to get an idea for exactly what is bothering the patient. Once we answer the questions, we get down to the important part is, what would you like to do today? And that way we can kind of decide as a team, now that they know what they know about what's going on with their foot, what options they'd like to pursue. I see patients of all ages, from very young to very old. My practice skews a little bit more to the complex. I think that's a lot of times what people will come to see me for, and that's a lot of what my fellowship training was for. Patients that have had trauma in the past, that may have had a surgery and then a revision surgery, and now are dealt with this deformed, painful limb. That's a lot of times what I'll see. The other times when we see complicated patients are their medical history may cause a big issue. Diabetics in particular, or patients with rheumatoid arthritis will have systemic diseases throughout their entire body, but also particular complaints at their foot and ankle. Those can really be a complicated issue in that you have to take the entire body and the entire patient into account. The most rewarding thing that I can see with a patient is seeing them get back to the activity that they want. A lot of times I'll see patients that have debilitating problems. They really can't do anything. Can't even do simple things like go for a walk around the block or go see their grandkids. I'd say that probably the most rewarding patients I see are typically my total ankle replacement patients. These are the patients that can't really get around to do anything. They're very sore. They're having a tough time even do minimal activity. And a lot of times we can get them back to walking or playing golf or spending time with their kids. I think that's just tremendously rewarding. And patients really do respond to that as well. They love to be able to get back, get active, do the things that they want to do. I was happy to join BayCare Clinic. I think it's a phenomenal specialty-based practice. And I really think their subspecialty focus on things is exactly what melds very well with my practice. Again, we're all a team. We want to make sure that we can provide the best care possible, and having a team-based approach so that people can do the various unique specialties really melds well with my practice.